name is Benedict Sayayura here from the emergency department. We are all wondering why we are in pink today on a special Wednesday morning. Our usual talk is going to be on breast cancer awareness, which is usually done in the month of October. I'm going to introduce to you the head of department, Miss Aisha AJ.
Thank you. Good morning, everyone. If you can observe me, I'm doing pink today. Today is Pink Wednesday, and the month of October, as my big madam said, is purposely for creating breast cancer awareness. So I'm here to do just a little talk with you. This is a normal thing we do every Wednesday. We engage our clients in talk shows. So if you could see, you were watching some videos on TV. I usually am the face of the Wednesday talk, but we'll be changing things because they say I'm a star, Bruce. It's star, so the other star. It's all relaxed kakra. So just on the lighter note. So my name is Aisha, as she stated, and as a month allocated for breast cancer awareness, pink is the color of choice. So if you are wondering why everybody is in pink today, it's because pink is the color of choice for creating awareness on breast cancer. So I'm here to do a little talk with you, a little education, so that you know what we are talking about when we say breast cancer. So somebody will ask, what is breast cancer? Now, breast cancer is a disease that affects the tissues of the breast, usually of women and men as well. Usually of women because women, our breast tissues are quite huge. And so the possibility of getting a cancer in it is greater compared to a man. I know some people's faces have changed. They are wondering why, what has breast cancer got to do with a man? So long as you have a breast, you have the chance of getting a breast cancer. So today, my purpose for standing here today is to educate you on what breast cancer is, what you can do to prevent yourself from getting breast cancer, teach you about the risk factors, and then what you can do if you are diagnosed with breast cancer. So as I said earlier on, breast cancer is a disease that affects the tissues of the breast. What happens is that the tissues of your breast multiply in a lot of times than the tissues are usually supposed to. And so when it becomes too much, it affects you and your normal functioning. So somebody will ask, what are the factors that predispose you to having breast cancer? One of the predisposing factors that exposes you to getting breast cancer is family history or hereditary. So if you have a family history where you have your mothers or your aunties or your cousins who have suffered from breast cancer, your chances of getting breast cancer as a woman is very high. So first of all, if you have a family history of breast cancer, as a woman especially, you should be on the lookout. Secondly, we also have lifestyle. If you are obese, it can predispose you. If you take excessive alcohol, it can predispose you. If you do tobacco use or substance abuse, especially anything that has got to do with tobacco, you are likely to get it. These are the three main things. And another thing too is certain conditions of the body system. It causes your tissues to reproduce in multiples. And so these are the four main things that predisposes you. So the first one that I spoke about is hereditary. And you can't do anything about it. If there's a family history, you cannot do anything about it because usually it comes to the bloodline. So what you can do as an individual, if you have a family history of breast cancer, is to just make sure that once you have that high chance, you always make sure that you get your screening done. That way, when the cancer cells start producing, we can quickly detect it and then start therapy for you. The second one that has got to do with obesity. You take in a lot of fatty foods, you are not exercising. It is just lifestyle modification. You can do something about it. So who say oba, check your weight. Very important. Most women in Africa after marriage, They believe that today I'm here to tell you that but in the long run it can give you problems. The third thing that I also said, it's also got to do with lifestyle. You abuse alcohol, you abuse cigarettes. All these things are your choice. You can decide today that alcohol now cut down on it. If you can't stop entirely, you can cut down on it. After smoking. Now the women are doing a lot of shisha. Meanwhile, we are in the risk group. The men have also joined. Men, they have been doing their cigarettes and their tobaccos already. But this new addition is predisposing us. And mind you, breast cancer is one of the highest killers of women after cervical cancer. Some of these things, you can do something about it. Alcohol mawuti na ordinance enne me pa ucho yentwa so wo dey say ya we 3 bottles and now they started 2 bottles. Eventually you will get to 0 bottles. After so substance abuse as a youth when you are enjoying yourself and you believe that you can do these things. At the beginning it looks like fun, but at the end of the day it gives you a lot of issues. So please, you can do something about that one too. The last issue, which has got to do with certain disease conditions, those ones you may not be able to do anything about it. Because some of the conditions, are predisposed to it. That is why we are saying that breast screening is very important at an earlier stage, so that even if you're on some of these medications and they are predisposing you to get cancer cells, we can quickly intervene and then help you to come out of it. So my next step is, what do you do to prevent yourself from getting it? Number 1 is breast screening. And this is my area of interest. So for women, we advise that every month, at least, if you don't do at all, do your own breast self-examination. The reason why we encourage women to do breast self-examination is because you know your body better. For example, if you come to me at the hospital and you say I should do breast screening for you, I don't know how your normal breast looks like. You can be able to tell me that there are differences in how your breast looks like. So we advise that at least at a particular time of the month, every month. So if you want to do it maybe in the middle of the month, then every middle of the month, you do this self-examination. If it is at the end of the month, every end of the month, you do this examination. This is because we want to build consistency. Now, if at the end of every month, you do this check, and there is a change the following month, you'll be able to detect it. But if you take the middle of the month this month, next month you are doing the beginning, the following month at the end of the month, you will not be able to determine if there is a change in it. So we advise that as women, every month at a particular time, you do this self-examination. And it is very easy to do. So I'm going to demonstrate it here today for everybody to see. When you go home, you educate your aunties, your sisters, your grandmothers, and even yourself. So when you take this, your hand, usually we advise that you do it whilst you are lying down. Because when you do it that way, it gives you a wider surface area. So let's assume I am lying down. So when I take my left hand, it will examine my right breast. If I take my right hand, it will examine my left breast. So when you are lying down, for example, let's assume I'm lying down. You raise your hand and put it at the back of your head. So this is how you will be. Then you take this, your arm. Now we start the examination from under your armpits. So watch me. And we do it in a circular motion. Now we use the palms of our hand to do the examination. So for example, I'm going to examine my right breast. I've taken my left palm. My right arm is behind my head. I'm lying down. So obviously my breast will be scattered all over the place. This one I'm brazier, so it is standing. So you take your left arm. You start from your armpit. Now watch the way I'm doing it. You go in a circular manner. You start from here. So you go down like that. Whilst you are going in a circular manner and be feeling your breast. You understand? Be feeling your breast. So this is what I'm doing. So if you watch me, I am going round. I am going round. So you realize that as you do it, as you keep doing it, then you'll be coming towards your nipples. So you keep doing it in a circular manner till you get to your nipples. When you get to your nipples, you hold your nipples and squeeze it. That is what I am doing for you to see. So you are done with one breast. You do the same thing to the opposite breast. Now, this is where it gets interesting. For women who are married, we want to encourage your husbands to be doing it for you, because they usually play with our breast and they can tell when there's a change in the breast. The purpose of this examination is to help you determine, first of all, if there's a change in the skin of your breast, the texture of your breast, the skin, you will be able to see it. And then also when you get to the nipples and you do this, and there's a discharge, you can see it. So these are the three things that we are looking for. First of all, we want to see the texture of the breast, the skin color, and the skin nature, and then thirdly, discharge. These are the things that we expect you to look out for. First of all, if you do this examination that I've taught you here, at a particular time of the month, when there is a change, one of the first things you see is that there's a lump in the breast. Everybody knows how their breast feels like. And so when there's a change in it, you should be able to say, I don't know you. When you come to me for the first time and I'm examining your breast, I may feel something and tell you it's a lump, but maybe that is how your breast is. That's why we encourage you to do it yourself. So first of all, you are looking out for a lump in the breast. Then secondly, we have something we call peau d'orange. It's French, meaning orange skin. When you see that your skin is looking like that of the orange, if you can take your memory back and imagine how the skin of the orange looks like. It looks like there's, dot on it, pores on it. If you see that the skin of your breast is looking like that, it is an alarm bell for you. Then we also have what we call dimpling of the skin. Like when you do this, there's a dimple. If you touch your skin or you try to depress your breast and it falls in like a dimple and it doesn't come back, that is an alarm bell. Then the last thing is the discharge from the nipples. If you are not a nursing mother, we are not expecting you to discharge anything from your breast. And even it is not just anything. If it is not milk, but it is liquid, sometimes it is very offensive. Some also look like condensed milk. All these things are discharges. If you are seeing any of these things as a woman, please don't stay at home. Don't go and buy cream and use it on your breast. Remember, it has been said and research has shown that early detection saves life. So please, as soon as you see something like that, don't let anybody deceive you into thinking that you can buy herbs or cream and put it on it and it will disappear. Please, we beg you. So I will emphasize it again. Raphael Medical Center has dedicated the entire month of October for breast cancer awareness. We do breast screening from Mondays to Friday between the hours of 9 a.m. to 5 p.m. Please, I am begging you, free. We don't charge anything. And we are giving discount on all breast scans that you do, 30% discount. So please, don't hesitate. Come here. If you have any challenges and you come to any of the nurses here, we will be able to give you the information. Please, early detection saves life. So men, we also encourage you to also come for us to examine your breast. Mumbra ne fele monofo no kakra. Ye pamucho mumbra. Yes, your chance e benya nie. Enti mpacho wo ye wi amekoye wo. Bra wo so mekoye wo. Daddy wo so mekoye wo. Mema na wo ha nyina magye mo aboso. I'm going to do the examination for you. Mi mo bia anye. E na afensu mu kofia. Eyire no mo mambe ma no so so monofo mu kakra. Because that is where we can also get them to help us to determine that there are changes in your breast. October dear, give them the breast. Let them work on it for us. It is the month of breast cancer awareness. Because apart from cervical cancer, breast cancer is one of the things that we want our women to live long. That is why we are creating this awareness. Enti, nyame ya adoma, Uba Rafa Medical Center between the hours of 9 to 5 p.m. every day from Monday to Friday. In the month of October, we are available to do this breast screening for you. Now, my last point before I finish. So somebody will say, okay, I didn't get detected early. Now I have breast cancer. What can be done for me? A lot of women, the problem we have with them is usually when a cancer is detected in your breast tissues, because cancer cells spread very fast. For some, if you are detected early enough, we can start what we call chemotherapy. What chemotherapy does is that it targets the cells of the breast that are growing rapidly, and then it stops the growth. Sometimes when you start chemo, it's quite painful because it's new medications being introduced into the system. If you are lucky, it goes into remission. It doesn't come again. But for some, the spread is such that if we don't do anything about it, it will spread to the other organs. And the quickest organ it goes to is the lungs. The lungs are the biggest organ of the body. Lungs, so for most women who are detected late, the option is to go for, surgery where your breast is taken off. And in Africa, there's this misconception that if a part of your body is cut, it means you are not complete. So most women refuse to go for this surgery. And they get people telling them that I have herbal medicine that can help you. So you're too late. Please, say you detect say please avail yourselves. Because you see, now we have what we call prosthesis. They can put prosthesis there for you without you even knowing that your breast is not there. Now they are doing silicone breast, which feels like the normal breast. Please, it will be best to lose one of your breasts and live long than to keep that breast and die. About time, when you die, who takes care of your children? Who takes care of your home? There are a lot of things you would have done if you were alive. So please, women, if you are detected to have this, it is not the end of your life. It doesn't mean that whatever you find yourself doing has come to an end. Early detection, as we keep saying, saves life. So if it is determined that you have it, there are steps that we can. There are support groups too that are available to support women who have had this operation done for them. Mastectomy, that is the name of the operation that we do for you. When your breast is taken off, there are prostheses that you can put there. Some people are walking around with prostheses. If they don't tell you, you wouldn't know. The only person who might probably know is your husband, who you are home with. Please, let's seek early treatment and then save lives. So thank you all very much. I've ended my talk for today. If you have any questions for me, please, I'm available to answer your questions. Thank you very much.
Breast cancer and chest cancer. This was the difference between the two of them.
Breast cancer and
chest cancer.
Chest cancer. This is the first time I'm hearing something like that. Okay, so I think that there's a misconception, okay? So you were not here from the beginning, but what I explained is that usually when we say something is a cancer, in layman's terms, what it means is that the cells of your body are multiplying more than. So let's assume that maybe your finger, the cells are supposed to produce like 2 every day. But in your case, you are having like 10 being produced. Obviously, what it means is that your finger will look bigger than the normal. Because if it's 2 a day, it has a sequence that it grows with. So when it comes to cancers, there is no definition for what, specific definition. It's just layman's term that multiplication of your tissues or cells of your body. So regardless of where it is, so as you said, I will use your own terms. There's nothing like chest cancer. It is breast cancer. And if you have a cancer, it is either affecting an organ of your body or a part of your body. In this case, we are talking about breast cancer because it affects the tissues of the breast. That is why it is breast cancer. If you are talking about anything regarding the chest, you have a lot of organs in the chest. Your heart is there, your lungs is there, your trachea is there, and cancer can affect any part of your body. So regardless of where the cancer is affected, we name it after the part. And in this case, the difference will be the part of the body it is affecting. That's all. Do you understand? But the process is the same. Yes, boss.
Women. The tissues in it and that of the women. Do men also have the breast cancer?
Yes. So thank you very much for that question. So I stated earlier on that men also get breast cancer. The fact that you have tissues in your body, you are predisposed to having it. But women, when you take a scale of, say, 100%, women will have about 95% chances of getting breast cancer compared to men. Because, as you can see, our breast tissues are larger than that of men. So yes, men can also get breast cancer. It's just that the percentage is lower. That is why you hardly hear them talking about it. But men get breast cancer. Any more questions? Boss, do you have a question?
Do they chop their breast also?
Oh yes, yes. We have men that we've done mastectomies for. Yeah. We take them off, especially if it is a very aggressive form of cancer. And taking it off will save your life. We do that. Yes, boss. Please, he has a question for us.
Yes, upon you giving the causes of cancers, you never made mention of the food we eat, the junk food. Why didn't you bring it up? But you stated on the alcohol, George C. Shah. Meanwhile, the food that we eat these days, what can that one to do to us?
So let me be very honest with you. There hasn't been any emphatic study to state that the foods that we eat contributes to breast cancer. But the truth is that I stated an issue about being obese. And you and I know that the kind of foods that we eat predisposes us to getting obese. So if you don't want to put yourself in the risk area, then you know. That's why I stated that it is a choice. You and I know that if you eat healthy, you will maintain your body shape and then weight. But if you do junk food, you and I know that obviously you will get into that obese area. And see, Nana Mwasuma, he has actually spoken for me. I didn't want to go there because there hasn't been any study to specifically say that maybe this kind of food will give you this condition. Do you understand? But the thing is that anything that you are doing that is putting you in that risk bracket, you should stop. And it is a choice. So thank you for mentioning it. It's in Pamucho. Because eduani bi wo ha would to us, especially say obia ye fried rice and chicken, ye chicken fries, ye peas and once in a while. No what's here for, but if it becomes a regular, then you know where you are putting yourself. So please, does that answer your question? Thank you. Please, any more questions? Okay, Madam has a question for us.
So my question is about, we talking about lifestyle, our food and everything, making somebody obese. Now, I've also realized something. We always connect maybe other sickness to somebody who is fat. Is there a way that maybe a slim person can take all these fatty things? Maybe the person will not be fat, but will have other symptoms, because people who are slim tend not to even go to hospital at all to go and check what is worrying them. But they will go and check, and you realize that they have a lot of things that they didn't even know of.
Exactly.
So it's not, most of the times, I think when we talk about obese, it makes the slim people think it's normal because they are slim. So maybe we should tackle the other aspect of it and then make them.
Sure. Yes, so that is a misconception out there where people think that because we say that if you are obese, it puts you in the risk factor. Once they are not in that bracket, they can eat anything they want and do anything they want. So thank you for hitting on that point. So all that I'm saying is that apart from the fact that we talk about being obese, putting you in that bracket, it is lifestyle. It is generally lifestyle. Because as you said, somebody may say that because I am not obese, I'm not even sick. But they come and you do a lot of tests on them and you realize that, so as Madam has stated, there's a misconception out there that, obese, nipa no ndi oyare, but obi is slim only the onyare. Today we are dispelling that myth that the fact that you engage in certain things, it is not only the body size that can expose you to this particular condition, but your lifestyle. So emphasis is on lifestyle. Because you will be no so who trace your family history. They are very big people. They can't do anything about it. I had a friend that I used to work with in school. She's big, but she will tell you that in my house I'm the smallest. So for somebody like that, you cannot say that because she finds herself in that bracket, she is more sick than somebody who is slim. So thank you so much. So she has raised the point. Even if you are slim and you are indulging in certain vices, it still puts you in that risk bracket. Please, any further question? Oh, Madam Benedicta, will you add something for us? Are you done? Do you have something you want to add for us? Okay. Pamucho, are we all satisfied with the answers that we've gotten today? Yes. So I'm very hopeful that after here, all the men that I have picked that I will do the testing for will come. Because today, I want to feel the men's breasts. I want to feel their breasts. So all the men here, please, I have registered. Nobody is going to do it for you. I will do it beautifully for you, and I'll teach you how to do it for your wives at home. Thank you all very much, and welcome to the month of October. Raphael Medical Center is the healer at work. Thank you all.
Thank you for watching this video. Kindly follow us on Instagram, TikTok, Facebook, and X at Raphael Medical Center. Bye.